This video complements the Advanced Supervisors training conducted with supervisors during a recent Healthy Families Florida Program Managers meeting. Actual supervisors and family support workers from the Healthy Families Orange Project were used and videotaped during the live supervisory sessions. The videotape and training were developed to help address some of the needs and concerns noted during the focus groups. Let's take a moment to discuss the concept of supervision as a gift. One of the topics of concern noted during the focus group was lack of time to carry out good supervision. Supervision is an art. In fact, good supervision requires time management, organization and preparation, active listening, maintaining professional boundaries, concise documentation, and positive feedback. Let's listen to one supervisor's techniques for effectively conducting good supervision.
Supervision is something that I prepare for pretty constantly. Upon submission of the documentation, I review and annotate any questions or concerns that I may have regarding creative outreach that has taken place, PCI, any kind of significant family events that have taken place. I also print out the due lists and review any pending outcomes. Organization is extremely important due to the fact that it reduces the time spent conducting supervision for both the FSW and for the supervisor. Ways in which I keep myself organized for supervision is I have a system, a color coding system for each FSW in which all their data or documentation gets filed in. Documentation has already been read, any questions or concerns have been noted and have been cited. So when we do go into supervision, I can pull their chart or pull their color-coded file folder, and we can review anything that's been flagged as a question or concern. Some ways in which I show staff that I value what they're saying. I express interest in what they have to say, use reflective listening, ask questions, making sure of my nonverbal communication, position of hands, arms, legs, providing the eye contact. Also, I put my phone on Do Not Disturb, so I eliminate any interruptions as far as that's concerned. Place a note on my door, Do Not Disturb. Staff are aware that supervision is that one-on-one time. Praise is important. Praise is something that follows our strength-based approach. Praise is energizing, empowering, and motivating, not only to families, but to FSWs.
I also gave her smoking can help the baby, because I'm reading from her narrative. She does smoke. So we talked about, smoking and how it informs, like you should change your clothes and like how you should smoke around the baby, things like that. We talked about, I gave her the handout for shots and well baby visits, and when your baby is sick, I told her, don't call me. I just wear the uniform. To please call the pediatrician if she needs help. I can take her to the pediatrician. I can do anything, but I always call the pediatrician first and get his opinion, or either just ask the nurse, ask to speak to a nurse when she calls, and the nurse will tell her, do she need to bring her in, or do she, could she wait out for a day or so?
Well, good way to clarify the separation, yes, because they do confuse.
Yeah, I'm not a nurse, I can't tell you.
Your documentation does really paint a true picture of what events took place in the home, especially when you relate it to GGK. So I want to say that you do a really good job documenting your PCI as it relates to the daily dues.
As this supervisor explained, effective supervision requires organization, preparation, time management, the ability to actively listen to what staff are saying, as well as helping staff develop professional skills. Let's take a moment to review the components of good supervision and discuss some techniques we can use to conduct good supervision. One of the most critical aspects of managing your time as a supervisor is understanding the difference between clinical and cursory supervision and learning how to manage the number of clinical and cursory supervisory sessions you're conducting. Let's review what's meant by clinical and cursory supervision.
As a supervisor, time management is very critical. One method that I use to aid my time management is the duration frequency form, which allows me to see the days that I have scheduled supervision with a certain FSW, tracks my consistency, the length of time, and, it helps me determine whether or not I need to change the day of supervision. Some useful techniques that I use to conduct supervision is definitely the supervision log that's been redesigned to help address issues in clinical and cursory supervision. For example, if it's clinical, it's a little bit more in depth. You want to make sure to follow up on things such as any kind of significant family event, any assessment issues, health and safety concerns, PSI, any pending outcome such as the ASQ, home safety checklist that's upcoming, and referrals, progress towards level change, whether or not their immunizations are up to date. When it comes to cursory, it's not as entailed. You want any kind of general comments or concerns that there might be, the last contact that the FSW might have had with the family, the date of the last home visit, and if there's any new contact that has been completed since the date of the last visit.
Last visit remains April 5th?
Yes.
Any new contact after the 4th?
Yes, after the 4th of this month.
Mm-hmm.
Yes, I had a contact on yesterday.
On the 9th?
Yes.
What kind of contact did you have?
I did a little creative outreach. I went to her place of employment
Okay.
that you suggested I do.
Any luck?
Yes, I went to the 7-Eleven and they said, oh, she's working across the street. So I went across the street, and actually she have 2 jobs now. She said that's why I haven't been able to contact her.
Oh.
And I told her I had been calling her cell number and the job. They said, yeah, every day I come in, they tell me to call. So, but she said she have 2 jobs, and she's supposed to call me by tomorrow to let me know what day we actually could do a visit.
So what is her second job?
She worked at McDonald's in the morning and 7-Eleven at night.
Oh, she's got a busy schedule.
Yes, and I asked her about the kids, how they was doing.
Mm-hmm.
She didn't tell me what daycare, but she did say they was in daycare. And she told me that, I said, well, who get the kids when you go from this job to the next job? And she was saying that his mother will pick him up, or her friend will pick him up. It'll be somebody to pick him up for her, and then they'll come pick her up that night.
Okay. What about, is there anything in specific that she needs that maybe she's lacking, any kind of diaper formula, anything?
Actually, she said she's doing pretty good, so.
Okay. So you were successful in your hunt.
Yes.
All right.
She was surprised to see me.
I bet she was. Little did she know you were going to show up there
I
and
know
see her.
it. She was very surprised to see me. She was like, oh my goodness.
We'll find you. Was she okay? Well, was she okay with you?
Yeah, she said she was fine. I asked her, did it bother her by me showing up like that? She said no, that she was fine. And I thanked her for taking out the time. She went back and told her manager that she had to talk to me for a minute.
Oh, wow.
So I thank her for taking out the time just to, talk to me for a few minutes.
Great.
Yeah.
And that was a good creative outreach.
Thank you.
technique.
And I also went by, on the creative outreach, I went by the doctor's office that she gave me.
Mm-hmm.
Because remember when I met this mom, I only did one visit with her.
Right,
And
which
then-
was that April 5th
Right.
visit.
So
Okay.
all the information she gave me was true. When I went to the doctor, the baby is up on all the immunizations and well baby checkups. So
Great. Do you have the medical tracking form?
I submitted one.
You did.
Mhm.
Do I have it and just not?
Thank you.
You did. I have it documented right here.
Okay.
Excellent. All right. So the 6-month immunization and well baby is complete.
Mhm.
We'll get that in there. Now she does have a few things that are coming up.
Okay.
She's got the FSP update, which is actually due this month.
Okay.
She's got an 8-month ASQ that's going to be coming. those are actually,
Is it too early for a PC or PSI?
yes.
Okay.
So that's see, that window opens May 10th, so it opens today.
Okay.
Okay.
So I can't do the PSI on my next visit?
That's the 8-month ASQ.
I mean, okay, that's 8 months.
Yeah, the PSI will be due next month,
Okay.
and that'll be the 6 month from the baseline.
Okay.
I'm not sure that, I didn't read in the documentation that she had been, that the scores were reviewed with her.
Okay.
So maybe something that you want to catch her up on, you know,
Okay.
how she, when she first completed it. She didn't have any areas of concern. All the scores within normal range.
Okay.
So also share that with her
Okay.
and let her know that there is another one that's upcoming. Does she, now on her, this, I don't know if you happen to ask her, maybe she informed you, her days off, does she try to coincide 7-Eleven and McDonald's, or are they opposite?
No, she tried to correlate both of them together.
Okay,
So when she have a day off at McDonald's, she want that full day off, like don't even go to work at the 7-Eleven.
okay,
Because she said by the bus situation, that it becomes costly and then too much time consuming on really a day off, that she would have to go into another job.
what about, did we ever follow up on the
Limits?
wages? Mhm.
No.
No, okay. See if you can follow up on that program.
Okay.
That might be a little bit more cost effective for her.
Okay.
Let me see what her goals are for. Okay. As a matter of fact, and again, I know that this was a transfer case. When we go to redo her FSP,
Okay.
relate it back, even if you need to take out the family needs scale from here and make a copy,
Okay.
take it back out to her
Mhm.
and just, instead of asking her, you know, what do you want your goals to be,
Okay.
a lot of the times it's kind of like me asking you, where do you want to go to lunch? The first thing that you're going to say is probably, I don't know.
Red Lobster.
So, oh, well, okay, yeah, that's true, because that is your favorite restaurant.
Exactly.
So, well, if I asked you, where do you want to go shopping?
Oh, that'll be out there.
So, it's something else that you like to do.
Okay.
So, when we go, we want to, you know, she has some items in which she's identified that she needs help. One is emergency child care, the other one is finding time to get to your clinic appointments.
Right.
Be a goal, you know, trying to help her turn those yeses into nos. The
Okay.
majority of the other things, you know, she indicates that she doesn't need help. So we want to, we want to make it as realistic as possible for her. And also with her work schedule, something that was identified on the FSP was taking a trip
Okay.
to Miami Beach. Taking a trip to Miami Beach, a family trip to Disney.
And the last I talked to her, she didn't get a chance to do either one of those.
Sure. And those are, you know, even if that's her ultimate goal, we still need to take a few steps back.
Okay.
What is she going to need for that trip?
Okay.
Are you going to need money? Are you going to need transportation? Or do you have transportation? Do you have someone to go with? Let's break it down in smaller pieces,
Right.
so it doesn't become so overwhelming.
Wham for her to accomplish.
Right. Because we definitely want her to succeed. We don't want to set her up for failure.
Okay.
Okay, so we've established contact with her. She doesn't know what her schedule is.
Not as of yesterday. I mean, as of yesterday. She did.
So she wasn't able to schedule a visit. Okay. Do you know when she would get her schedule? When
She
would
said
be on?
tomorrow.
Tomorrow, okay.
She basically based her schedule off of McDonald's for the 7-Eleven. So
She making more money at McDonald's?
she's not making more money, but she been working at the 7-Eleven so long till they letting her fix her hours because they know she need to work 2 jobs.
Oh, okay.
Yeah.
So that was actually very accommodating.
Yes.
Okay. Okay, so we'll follow up with the wages program and all of her pending outcomes, which again are the 8-month ASQ and the FSP update.
And share the update in the PSA.
Yes, and the PSI is actually next month.
Okay.
Now those, let's see if I have. She's actually not showing up for this quarter, but it was completed in, her initial was completed in December.
Okay.
And you still have your due list, actually, 6 months from baseline. I'm sorry, let me take that back. 5/14 is her open, is when her window opens for her PSI.
Okay.
So,
On my next visit, I can, okay.
let me go ahead and complete a request form for that, so you can have that ready to go. We'll get that ready for you. And we just need to follow up with her schedule and see when she'll be available. The links, the wages program, and again, those family service successes are 8-month ASQ, 6-month PSI, and FSP update.
Okay.
Okay? Any questions?
No.
On the FSPs dating back from November, if you could revisit those with her so we can close those out.
Okay.
And the April client service.
Okay.
See if we can also find out the daycare the children attend.
Okay.
Good documentation on your creative outreach efforts.
Thank you.
Also, good documentation on the fact that you praised her for taking the time out to talk to her. That she took the time to talk to you.
Yep. Thank you.
She's cursory this week. Okay. 1 home visit completed, 1 to be completed.
Yes.
Since she's been promoted to
So
level 2.
yes.
Last visit was 5/9.
Yes, yesterday.
Any new contact?
No, I haven't gone.
Is he still continuing to host, wait, I guess, be a waiter out?
On his job?
Yeah, is he a waiter? Still a waiter? Okay. Has she gone back to register for school? Has she given any additional funds?
She is attending the workforce seminars.
Okay.
So that they will pay for her to go to school, because if you attend our seminars for workforce, they will assist her in going to school, and they give her child care, and that's the easiest way for her to do it right now.
Okay.
Instead of going to 4C, being put on a waiting list, and then still having to have the child care and everything, so she can't find a job. So we have been talking about it for about a month or so. So she finally started doing the workforce seminar. She do, I think, 1 a week for so long, and then once she finishes all the seminars, they'll give her assistance and they'll help her go back to school or work, whichever one she wants. Right now, she wants to go to school to be an LPN.
Okay.
So when she finishes all her seminars, they'll pay for her to go to school. She just have to choose a school then and get the fund and make sure it's approved through workforce.
Mm-hmm.
Once it's approved, they'll give her it's called temporary child care assistance, but it'll end up being permanent because she can just go straight into 4C.
Okay, when she graduates. Okay. When is her expected graduation date?
She's not sure yet. She has to see about the program.